Okay. All right. Hello, everyone. My name is Leah Brenam. I'm here on behalf of the Maternal Infant Health Outreach Worker Program at Vanderbilt School of Nursing. And I also have Latika Alexander with me today, who's outside of the shot, but she has a lot of experience participating in and facilitating some of the healthy pregnancy and positive parenting groups that we're going to talk about today. So she's going to bring some of that experience if there are questions, and she's also just going to help keep me in line a little bit because that's her expertise. So just a brief overview of what our proposal was. We submitted a request for $50,000 for the implementation grant to focus on implementing those healthy pregnancy and positive parenting groups, which will align really well with the CHIP priority goals, both to provide that support for parents in positive mental well-being, as well as providing some of those positive parenting skills that would hopefully help reduce some of the violence that we see in homes. Through this project, we will be collaborating with many of our lovely community partners that kind of span some different sectors. So we've got some family resource centers that we would be partnering with, Maplewood, Antioch, and Glencliff, as well as a couple other service providers, Renewal House and Salvation Army. We've got some standing relationships with them. We've also begun works with the Cambridge Early Learning Center with MNPS. And then we've also developed a partnership with Youth for Christ, which helps us get into some of the parenting groups with teenagers in some of these different metro high schools as well, which has been a wonderful relationship. Okay, clicker. Here we go. So some of the need that we see in the community that might provide justification for us to do this type of project. What we know is there is even though we see development in Nashville constantly, we still have a high level of poverty in Nashville. And we know that that poverty can lead to some stress and anxiety for the parents who are experiencing that. And that stress and anxiety can lead to negative health outcomes for their children. And so we see that taper down into even further negative health outcomes, including inadequate nutrition, maternal depression, substance abuse, other traumatic events, etc. So that's the kind of stuff that this MyHow model is looking to address with the groups. Make sure I'm not missing anything. All right, so the overall goal for our project is that the parents we work with will achieve or maintain positive mental well-being and then practice these positive parenting behaviors. And we're hoping that then that will trickle down for more positive positive health outcomes for their children. So when we break it down into the outcomes that we'd like to see at the end of this project, we're projecting that 50 of the parents who participate in those groups will report positive interactions in the form of reading, singing songs, telling stories, and or eating a meal together at least 5 times per week. And then also 30 of the parents that we work with will report an increase in or maintenance of positive well-being, and we've got a pretty neat positive well-being scale that we use to measure that. On the road to get to those outcomes, MyHow will be training 10 of those partner agencies. We'll be training 10 of their staff to facilitate these groups in the future. So not only will we be facilitating those during the course of this project, but then we'll get some staff who will be able to facilitate those in the future. And then over the course of the fiscal year, MyHow will facilitate 96 different parenting groups throughout Davidson County with different parent populations. Some of the activities MyHow will engage in, we'll also be attending community events outside of the parenting group, so we'll distribute information on building strong brains, all that good stuff to try to get additional information out there to parents and families who need it. We'll also be meeting on an ongoing basis with the partners that we're working with to implement these groups, because at the end of the project, we're hoping to have that fully tweaked curriculum. So we'll be meeting with our partner agencies to kind of see what's going well with these parenting groups and see what we might modify along the way to make sure that at the end of the project we would have a great curriculum that's been tested and folks have had a chance to add some things to make sure that it works really well. Okay. making sure I'm not missing anything. One of the other added benefits and activities we've been involved in with our collaborating agencies is that we'll be connecting with them to provide any other resources related to social determinants of health that the parents that we're working with might need. So although MyHow doesn't necessarily provide support with housing or other social determinants of health, the partner agencies that we work with do, and so we'll be able to also impact health in that way, by connecting with other folks. So one thing that we didn't necessarily cover fully in our proposal, but I think what's really important about the MyHow parenting groups is what does that group session actually look like? And I'm gonna pull in Latika a little bit here as well. So you'll see up here we've got a few different things. Every group starts out with a little get to know you activity, because talking about health and talking about parenting can be a really vulnerable thing. And so we want to make sure that the folks who attend the groups will feel comfortable and vulnerable and be able to share some of that and learn from each other and really take away from the group. Every session includes at least 2 content areas, whether that's learning about ACEs, learning about routines, learning about building strong brains, something that will help parents understand more about their children, their child's development, how their parenting impacts them. Every session includes a healthy snack. And these snacks will also be the types of snacks that if you might have a toddler at home, it's something that they can participate in. So it's not just promoting healthy eating, but it's also promoting that positive parent interaction through making that healthy snack. Latika, am I missing anything? I know y'all do a lot in groups. Okay, I'm getting it. As long as I'm getting it all, you got to keep me in line. We do a lot with the parents as well around any sort of stress reduction or self-care. So we do some activities in the group that will help them practice some of that. I know we all have stress and we all have different ways of managing that, and so we want to introduce different ways so that parents can learn what works really well for them, whether that's mindfulness or yoga or something along that line. Okay. So we believe that we're really promoting health equity through this model by not only focusing on some of our low-income parents who might not have as much support around reducing that stress and might not have learned as much of that positive parenting interaction. So we're promoting health equity with those parents, but then we're also promoting health equity with their children. So as we're fostering those positive parent interactions, we're seeing that not only might the parents move the needle a little bit with their health related to their peers, we're also hoping that their children will then get to school ready to learn and be civically engaged beyond that, and lifelong health and all of those positive outcomes we might see for the youth. So for management and evaluation of the project, Vanderbilt School of Nursing has a strong track record with managing any sort of grants as well as measuring outcomes. So MyHow has a lot of support from the institution in that sense. And then related to evaluation, MyHow's had the opportunity to be a part of a few different randomized control trial research studies. And one of the most recent ones showed significant findings related to parents being more likely to practice safe sleep practices, read more often to their children, also have lower parental stress, and then have lower depressive symptoms, as well. And so we're really seeing that this model that MyHow uses is having a significant outcome on these health-related behaviors for parents. Okay, timeline and milestones for the project. That first quarter is really going to be a lot of the prep work, training with the folks who will be facilitating groups, working with our community partners to recruit participants for the parenting groups, and also getting most of the groups piloted in that first quarter. Second quarter is going to be a lot of just ongoing implementation of said parenting groups, as well as continuing to look at that curriculum that we're going to have produced at the end and make sure that it's updated and doesn't have any kinks to it. And then third quarter will be continuing to do all of that. The same as second quarter and fourth quarter, we're going to finish any remaining groups, analyze the data that we've collected over the course of the project, print that final curriculum, and get that out to our community partners so they can continue to facilitate it. And finally, a few notes on the budget as well as kind of our sustainability plan. MyHow has a strong track record of being aggressive about securing funding from different sources, and so we will continue to look for different funding opportunities that will help support the work that we do. Also, that component of being able to train our partner agencies to facilitate that curriculum in the future is a way that we see this work continuing outside of the term of the project and really kind of gives a larger scope. And then just a couple notes on the budget that we did request that $50,000. For the total project, we're looking at a little bit over $80,000, and that includes some additional funding as well as some in-kind dollars that we have committed. The majority of the funding requested goes to 2 salary positions, so the director of MyHow, who manages the whole project, as well as an admin who kind of coordinates all the details, as well as works on that curriculum to make sure it's all nice and beautiful at the end. And then the additional component of the request is those in-kind contributions that I mentioned, which would be facility space for groups. So we've got a lot of lovely partners who offer that up for us, which is wonderful. We also are able to get some donations for incentives to attend groups. Although we see our groups as really fun and engaging and awesome, we also recognize that parents have a lot of other things they could be doing with their time. So we try to provide an incentive to increase that participation, as well as many other materials, books and toys, etc., that we get donated in kind that will distribute to the parents that we work with. That's it.